this is something else I've come to recognize. And I tell people, right? Doesn't matter how good I might be as a heart surgeon. Doesn't matter how good all the heart surgeons and the cardiologists, are out there, right? You're never as good after you've had the heart surgery as you would have been if you didn't need the surgery in the first place. And so when I look at my role as a doctor, right? This isn't about me being a heart surgeon and only being able to do that. It's about what can I do to best improve the life of that patient that's in front of me. And if I can keep them from getting to the operating table, that is a major win.
Welcome to Metabolic Matters podcast, where we embark on conversations with thought leaders, disruptors, change agents, and passionate souls. I'm your host, Dr. Nasha Winters. Diagnosed with terminal cancer at 19 years old, my journey led me to become an integrative oncology specialist and champion of metabolic healing. Together, we'll delve into what truly matters to our guests and how you can metabolize that wisdom to transform your own metabolic health. Now let's meet today's guests. Welcome to Metabolic Matters, where we uncover the hidden drivers of chronic disease and explore how to unlock lasting health from the inside out. I'm your host, Dr. Nasha Winters, and today's guest has lived on both sides of medicine. As a surgeon saving lives on the operating table, and as a patient who transformed his own health by rethinking everything he'd been taught. Dr. Philip Ovadia is a board-certified cardiothoracic surgeon who has performed over 3,000 heart surgeries. But after his own battle with obesity and a 100-pound weight loss through low-carb living, he became a leading voice for prevention, metabolic health, and food as medicine. He's the author of the book, Stay Off My Operating Table, founder of Ovadia Heart Health, and a tireless advocate for helping people avoid the knife by fixing the root causes of disease. If you've ever wondered why doing everything right still doesn't move the needle for your health, this conversation will shift your perspective. Let's get started. Dr. Phil, how fun that we get to reclaim the name, although you and I were saying before the recording that he's done us proud as of late because he really is speaking to healthcare movement and reclaiming our health. So, used to be, we might have given the original, or maybe not so original, Dr. Phil a bad time, but he's been helping our movement, I think. But you and I were also trying to decide before this conversation where our paths first crossed and where they've continued to cross. And the coolest thing about this conversation today is, though my world seems to be really focused more in oncology and yours in cardiology, we're talking about the exact same thing. And so our first meetings have been at big metabolic health symposiums, as well as even big political events where we're looking at ways to even change policy in the healthcare arena. So Dr. Philip Ovadia, brilliant cardiosurgeon and author. So excited to have you in the room today talking about all things metabolic and metabolic matters. So welcome.
Thank you, Nasha. It is so great to be with you again and be talking about this. And you're right. There are a lot of exciting things going on in the world around us, and health, as we have been talking about it for a long time, seems to be coming into that sort of mainstream conversation, which is exciting to see. And, exactly what you mentioned there, right? That you and I are treating the same problem from very different aspects, right? Cancer and heart disease. Obviously, they're the two big ones. They're the two leading causes of death here in the United States. But it turns out, and this, like you, right? You probably didn't recognize this initially.
Right.
It's not how they taught it to us in school. But here we are recognizing that, we're just treating different manifestations of the same underlying disease.
Wow. And I think one of the things that excites me so much about you and your work, first of all, you know your way around the heart. have done thousands and thousands of surgeries to date. But I think what's even more compelling is you've been on the other side of that coin. You were your patient. You were the type of patient that you see. Can you walk us through a little bit of just your training, your background, and your big aha moment?
Yeah. So, I have now been a heart surgeon for over 20 years. Like you said, done, well over 3,000 heart surgeries at this point. And for most of that time, I was a very unhealthy heart surgeon. Mm-hmm. I was morbidly obese. I've dealt with obesity since childhood. I was pre-diabetic, and I came to that realization that I was headed for my own operating table, so to speak.
Wow.
And like so many of my patients, right, I didn't know what to do about it. Understand, right? No one wants to be on a cardiac surgeon's operating table, but they end up there. And, they end up there following the advice that, I had been trained to give. And I saw how following that advice, and I think I was doing a pretty good job of following the advice, right? Listen, there are some people who just don't follow advice, but most people want to do better, and they get a set of advice, right? And it's what we've all heard and been programmed: eat less, move more, follow the food pyramid, lower your cholesterol. And yet they were still ending up on my operating table, and I was headed there as well. And thankfully, I started thinking about some things differently. I started asking some different questions.
Wow.
And a lot of this comes down to just being willing to receive information, right? And find the information. I ultimately came across Gary Taubes, was really my introduction to metabolic health. Ironically enough, at a conference of cardiac surgeons, thoracic surgeons. He happened to be the guest speaker. He had just written at that time The Case Against Sugar, and he was sort of on his book tour. And, it's interesting. I've had the opportunity now to meet Gary and talk with him. And I've asked him if he remembered how he ended up at that conference. Because it's not really a logical place for him to be talking. And he doesn't remember. He just said, I was kind of in the book tour, and somehow, someone from the society reached out. And and the other thing I wonder about, right, is there were probably, 1,500 heart surgeons in the room listening to him talk. And I wonder how many were really absorbing and made changes similar to I did after that talk.
Wow.
Ultimately, went on a low carb diet, lost 100 pounds, reversed my pre-diabetes. And I've been able to maintain that. This is now coming up on 9 years since that talk. And along the way, I came to recognize that our approach to heart disease and what is that the root cause of heart disease wasn't what I had been taught. And I also sort of had my eyes open to what really should have been obvious. But you know how it is. You're kind of in the grind and you're not looking and kind of asking the deeper questions. Why were so many people ending up on my operating table? What they were following the advice, and yet they were ending up on my operating table. And it was only after I realized how wrong that advice is and how there's a better way for us to approach this that I've partially refocused. I still operate, but I'm more and more focused on trying to keep people off of the operating table. That's really the larger mission that I'm on these days.
That is amazing. And the fact that you were in a room, I'm trying to imagine 9 years ago, Gary Taubes in front of 1,500 cardiothoracic surgeons, like that in and of itself, as you noted, is a miracle. And then to be, maybe he was there to speak directly to you. Because I also imagine, I'm still having conversations with cardiovascular and cardiothoracic surgeons, probably on a monthly basis, who still are very much indoctrinated into what was, right? What you were yourself, trained in and whatnot. So I'm intrigued that out of that 1,500 people, I too would love to go back and, survey that room and see who even remembers the conversation, who actually maybe started to get curious and started to dig deeper. But you are extraordinary, Dr. Bill, for even sitting there and number one, listening, and number two, starting to maybe reflect back to yourself of your own life, much less that, the patients that you serve. So wow, that is just pretty extraordinary. You're you're a bit of a unicorn when it comes to that, because a lot of folks kind of get cognitive dissonance in their way, and you just scooched it right off the table, and you continue to do so today. I've had conversations with you and heard you speak that you're still learning, constantly learning and pushing the edge here, which I think is incredible. So when was that moment? Like, you heard Dr. Taub speak and you talked about sugar, but when did you really start to embrace the idea that perhaps cardiovascular disease is more of a metabolic dysfunction versus what you were trained initially?
Yeah. So, after hearing Gary talk, I immediately, went on a low carb diet. I literally read all three of his books at that point.
Oh, amazing.
By the plane ride home, and said, okay, I'm doing this. And, lost a bunch of weight, felt better, saw my pre-diabetes reverse and all of that. And then, that really got me asking, okay, why didn't I hear about this in medical school?
Wow.
Why wasn't this even mentioned? And if we were so wrong about that, what else are we wrong about, right? And that naturally led me to the cholesterol question and the root cause of the disease that I had dedicated my career to battling against, and realizing again that it was not how it was presented to me in medical school and beyond. And that just one question led to another, and you come to this realization that really most, if not all, of what we were taught and how we approach this disease is wrong.
Wow.
And then I, like I said, I kind of saw the evidence that had always been around me, right? Because if cholesterol was really the solution to heart disease, why am I still a busy heart surgeon, right? And it's ironic, I thought back when I was going through my training as a surgeon and I had to decide what area of surgery I wanted to specialize in. And I decided I wanted to go into heart surgery. Most of my mentors told me, do not go into that. You're crazy. This is early 2000, late 1990s. And we've solved heart disease, right? We have these statins and there's going to be nothing for you to do in 20 years. Why would you go into that field? It's a dying field. And here we are, 20, 25 years later, not only has heart disease not gone away, but it has continued to get worse. There is now actually a shortage of heart surgeons in this country. There aren't enough heart surgeons to go around and do all the surgery that needs to be done. So what does that tell you, right? And, that was just another sort of big picture thing that I had my eyes open to. If cholesterol was the cause of heart disease, it should be gone by now, or it should be a lot better by now, at least, because we've been singularly focused on lowering cholesterol. We've been successful at lowering cholesterol levels. People, when we look at the societal numbers nationwide, we have a lower cholesterol than we have ever had. And
Wow.
yet, heart disease is still far and away number one. So that's one of the big facts that you just can't get past if you stop and think about it. But most doctors don't, right? They're too busy to even stop and think about something like that.
Wow. I mean, my mind is so blown right now because I was in medical school in the mid 90s, and that was the year 1996, I believe, is when statins came to market. Is that about right?
No, that's when they became the most widely prescribed class of medications. But they were actually, the first statin was introduced, I think it was 1989.
Okay.
I want to say 88 is when the first statin came to market. But by 1996, they had become the most widely prescribed class of medications in the world.
Amazing.
And again, Here we are 30 years later.
Totally. I mean, it is so ironic for them to be saying that to you, like, why are you going to this? It'll never be a job for you. And the irony is even you and I remember the day when we used to, on our labs, say that a cholesterol of over 300 or a triglyceride over 399 or was normal, right? And then it was the one lab value we started to change in hopes of selling more of a drug, or in hopes of diminishing a value to change cardiovascular events. And to your point, that hasn't changed at one iota. In fact, we continue to try and push those values down even lower to our detriment. Even this week alone, I consulted with someone who's on two different, they're on Repatha and another statin drug. Their overall cholesterol level is 75.
Yep.
So these are the moments. And guess what I'm seeing him for? I'm seeing him for cancer.
Amazing how that happens, right?
Yeah.
We will certainly get into that. But yes, I agree. I've seen patients with LDL cholesterol levels in the single digits. And it is, yeah. And their doctors are like high-fiving each other, right? Thinking they're doing so great by this person. And, unfortunately, you're right. They may very well, maybe they don't end up on my table, but they're going to end up on yours. Right? Because cholesterol is such an important part of our immune system. And, and again, this is what the data actually shows.
Yeah.
Right. But doctors never get to see that data. They
get the highlights and it's highlight through a particular filter.
Yep. Exactly. And that's one of the bigger problems with our medical system. And our educational system. And it's something that we're going to have to wrestle with and attack, certainly. But for right now, again, I always go back to that individual patient in front of me and what can I do better for them? And, the answer keeps coming back to metabolic health, right? And this is one of the other things like we talked about in the intro. Even if you take all the cholesterol stuff at face value, right? The only thing that improving cholesterol has ever been suggested to improve is heart disease. When we talk about metabolic health, right? As you know, and probably as a lot of your audience knows, 9 of the top 10 causes of death in the United States are attributable to metabolic health. Metabolic health touches everything. It touches heart disease. It touches cancer, right? Which is how we came together.
Yeah.
It touches mental health. It's diabetes, it's chronic kidney disease, it's chronic lung disease. These are all metabolic problems. So even, again, when we get into that maybe problematic area, right? Where people improve their metabolic health, but their cholesterol goes up, and everyone starts freaking out, right? Because we're that patient's now going to die of heart disease, right? And we'll talk about why that may not be true. But even if it were to be true, right, you're lowering your risk of all this other stuff.
Yes.
It seems like a good, trade-off to me. And we have the bonus of, by the way, that increased cholesterol in the setting of good metabolic health does not mean that you're at higher risk for heart disease.
In fact, evidence suggests it's even a prognostic factor for better longevity. So it's just interesting how this is coming full circle. So I'd love for you to compare and contrast, what a conventional standard trained cardiologist or cardiothoracic surgeon would have been taught versus what the way you now approach it, the way you now think about it and approach it. And so, kind of sort of compare and contrast the fact that maybe I'm oversimplifying this, but many are sort of taught that you're just dealing with a pump issue, kind of a mechanical issue, and yet you're suggesting a whole different ballgame. So do you mind doing a brief overview, compare and contrast of what you learned and now what you understand?
Yeah. So I think, where the problem really comes from is, first of all, we have been led to believe, we as physicians, right, have been led to believe that heart disease is a very simplistic, straightforward process. You have too much cholesterol in your blood. That increased cholesterol in your blood starts to causes plaque to accumulate in the arteries of the heart. And then as you get more plaque in the heart, you start to, choke off the blood supply, and you can end up with a heart attack, and you end up with what we call atherosclerotic heart disease, which is the most common form of heart disease that we see. Not the only one, but it's really what most people are referring to when they say heart disease. Now, the problems come from, heart disease is not simple, right? It's not just straightforward thing that one test on your blood, one, number on your blood test can predict your risk of heart disease. It turns out that LDL cholesterol, total cholesterol, and even, the cardiologists that think they're being fancy and forward thinking, right, and talk about ApoB, right, that this one number can predict, it can tell us everything we need to know about your risk of heart disease. So that's problem number one. We stop, right? Doctors have been programmed to just stop there. All you have to do to lower that patient's risk of heart disease is lower that one number on the blood test. And clearly that's not true, right? Even again, I give some leniency, some latitude to my colleagues, and I say, okay, even if we're going to accept that ApoB, LDL somehow relates to heart disease, we can't just say this one number tells us everything we know about heart disease. What I now recognize, what many others have come to recognize, right, is it's the underlying metabolic health, the insulin resistance, the inflammation. These are the things that are driving heart disease. And yes, when you're in poor metabolic health, cholesterol can become problematic, but it's not cholesterol that started the process.
Right.
And, just by focusing on the cholesterol, you're missing all of this other stuff. So that's how I've started to sort of build the bridges, right, with my colleagues. And when I talk to cardiologists and, I give grand rounds at hospitals and stuff, I at least bring that in, and they are open to hearing that. And I think more and more doctors are recognizing this. Now, ironically, I guess one of the things that's even accelerating and bringing this to the forefront even more is we now have medications that sort of address insulin resistance indirectly, right? The GLP-1 medications, which are all the rage for weight loss. And, and again, we can talk about whether or not I think they're good or bad. But, one of the things they do is they bring forward this question of, okay, well, how are these things working? And one of the ways they work is they improve insulin resistance. So that leads us to, okay, maybe insulin resistance has something to do with heart disease. Now, even more ironically, and what people don't want to talk about is generally GLP-1 drugs increase LDL cholesterol in a lot of studies, and they certainly don't decrease it, right? So when you look at a study and it says, well, GLP-1 inhibitors are lowering the risk of heart disease, yet they're not lowering LDL cholesterol, this is also getting more and more doctors, I think, to kind of open their eyes a little bit and say, well, wait, I thought it was all about the cholesterol, so how does this work? And so in a roundabout way, that's maybe starting to help bring this discussion about insulin resistance and metabolic health more into focus.
Ovadia isn't another supplement line. It's a cellular medicine in a bottle. Created with Dr. Ahmed El-Saka and myself, each formula is clean, practitioner designed, and terrain approved to support pathways like blood sugar balance, sleep, and mitochondrial function. Explore the line at mitovita.com. Let's get back to your mitochondria. That is brilliant. And it's nice that we have these, kind of these situations that are making us rethink everything, right? And so even if they maybe aren't our favorite tool to reach for, they're certainly shining light on some misconceptions we have built entire institutions on. So I think that's really, really fascinating. And, I know you as a clinician. So here it is. You've now seen firsthand inside of the human body. You have seen firsthand sitting across from a patient looking at their lab results or maybe at their calcium scores or whatever other metrics you like to use. So you see the result of various diet and lifestyles on this. And when you started to apply this to yourself and started to lose the weight and change your own metrics, I am super curious how you were met when you told people, hey, I'm eating, because you were not just low carb, were you, if I'm remembering correctly, mostly even carnivore at the beginning of this? So I'm dying to hear how your colleagues responded to that part of your story.
Yeah, and that again becomes a bit of a lightning rod issue, right? Because I say, Yeah, it's not the red meat. It never was. And in fact, red meat may in many ways be protective against this. And so, what I have now come to understand, and as my, thinking and education has evolved, I realize that, nutrient density, right? Bioavailability, the quality of what we're eating is most important. And yeah, it was a lot for me to get sort of over that programming again of red meat bad, right? Red meat causes heart disease, red meat causes cancer. And then you start to dig into the evidence behind that and you realize, no, it doesn't. This isn't good evidence, and a lot of this becomes sort of political as opposed to scientific.
Totally.
So, I'll admit, right? Part of the kind of reasoning behind carnivore for me as a heart surgeon is exactly that shock factor, right? When I come out and say, as a heart surgeon, not only isn't red meat not bad for your health, but it's all I eat and I'm in the best shape of my life, that starts to grab a little bit of attention. Now, the real reason I do it is because I find it to be the easiest way to maintain my health. And I am thriving on that diet, have been doing so for, really about 7 years that I've been, what I would say mostly carnivore. And
Wow.
I am continue to be in the best shape of my life. And I continue to have no evidence of heart disease, a 0 CAC score, despite having an LDL cholesterol level that, back in the day, I would have thought was astronomical and was going to be putting me at imminent risk.
Wow.
But I have come to understand why it's not that way. And that now helps me, discuss with my patients. I don't tell all my patients you need to be carnivores. I tell them it's an option. I tell them it's a tool, right? When we're talking about things like insulin resistance and inflammation, right, it's a great way to reverse and lower those things. It's not the only way, but it is an acceptable way.
Yeah.
It is maybe, I would say, a preferred way, at least incorporating lots of animal protein into your diet. And then we work with the individual in front of me to figure out, okay, what's going to work for you? Maybe it's not full carnivore. You probably don't need to be full carnivore, but let's figure out, let's use that as a base and let's start to build off of it.
I love it. And so ultimately what I think I hear you saying is that whichever road it leads to, metabolic health is the right road. And that might be carnivore or carb restriction or intermittent fasting, as examples, and it's like any of those are going to make a shift in the metabolic machinery to move us in the right direction. I am curious, when you're talking to your naysayer colleagues, what types of evidence or resources or references you like to speak to help compel. Like, of course, you're your own N of one. Here's your data. Here's your before and after. They can clearly look at you. My guess is many of them have been watching you for 9 years now and said quietly in their own minds, what the, they're watching. But I'm curious, when they do push against it, what is your favorite go-tos for resources or references to compel them to maybe reconsider what they were taught?
Yeah. So, again, there's so many different levels you can go to, right?
Yeah.
And for me, the most powerful thing is still the results that the patients in front of me are getting. And now, in my telemedicine practice, hundreds and thousands of patients that we've taken care of who are seeing great results with this. And, from a cardiovascular standpoint, are doing exceptionally well. So that still remains top of the ladder for me. I go back to the evolutionary record, right? And I just look at what did we do for the vast majority of our existence as human beings. And oh, by the way, during all of that time, heart disease was not described, not a factor, right? It was a rare, incredibly rare disease until we started doing something different, right? And we started introducing this processed food and the high carbohydrate, right? And then we look at, okay, 1980, we introduced the food pyramid, high carb, low fat. What has happened since then? Heart disease has gotten worse, obesity, all of this metabolic disease has gotten worse. So, that's very hard evidence for me to ignore, right?
Exactly.
We used to eat a lot more meat, and we used to have a lot less heart disease. So how could meat be the cause of heart disease when those two things exist simultaneously? It just can't happen.
It's so interesting because I remember reading somewhere that we didn't really talk about, didn't really publish about the first really big cases of cardiovascular disease until I think the late 1800s. Am I remembering that statistic correctly or that information correctly?
Yeah. So we have some of the leading physicians of the late 1800s, right, that would publish kind of their lifetime experience, and angina, heart disease was incredibly rare. And up until really, the 1920s is when we start to see an uptick in heart disease in the United States. By the 1950s, it accelerates and becomes, the leading cause of death. And then, of course, we had events like President Eisenhower having a heart attack while he was in office, which appropriately set off alarm bells. But even before that, it turned out, when you go through the history, the war on heart disease was declared in the 1940s. And it just kept getting worse and worse. Now, unfortunately, President Eisenhower's heart attack in particular kind of brought to the forefront this idea about it being related to dietary fat, dietary cholesterol. It turns out that they kind of conveniently ignored the fact that President Eisenhower was a chain smoker, and that was probably the major contributor to his heart disease. And they, I would say, actively suppressed the idea that sugar, processed carbohydrates, was contributing to heart disease. So, that's how we kind of got to where we are. And again, I can forgive the fact that there was a hypothesis, right? And we thought, and that's what it was called, the diet heart hypothesis. You eat too much dietary cholesterol, dietary fat, it raises your blood cholesterol level, and that then causes heart disease. And okay, let's test it. And we did, and we have. And here we are 70 years later, and it has failed miserably, right? And both kind of parts of that equation, it turns out, are erroneous. Eating more dietary cholesterol and dietary fat doesn't necessarily correlate to having higher blood cholesterol levels. And then having higher blood cholesterol levels is a very poor correlate of heart disease, and it certainly doesn't cause heart disease. So we have now thoroughly disproven both sides of this hypothesis, both parts of it, and it's time to move on. And yet, because of some of those, like you said, we've built institutions based on this. It's very hard to turn that ship around, but hopefully we're starting to see some movement in that direction.
Well, so much of that is thanks to you, Doc. And in fact, your book really does give a bit of the context that we're talking about here so people could dig deep. It's not just your story, but it's the story of the cardiology profession in many ways and how to change that. But we also have colleagues like Gary Taubes that you mentioned, like Nina Teicholz, even like Denise Menger, and some of these others who've broken down sort of the industry behind our nutritional advice today that's not really based on health advice. So I just think that's really powerful. So folks can go in and look up, we'll put in the show notes, of course, Dr. Phil's book, but some of these other resources. If you want to get some historical perspective and historical context, it really helps you understand where we've come from and where we've landed. One of the cool things that you have changed, like your mantra, I'm assuming, even though it's been the same mantra over time, I fix hearts. My guess is the meaning of that phrase has really evolved over time for you. Can you tell us a little bit more about that evolution and what you mean today when you say I fix hearts?
Yeah, no, that's a great way to kind of look at this. So, 2011, it was, Twitter was just kind of becoming popular. And so I'm like, okay, I'm going to sign up for Twitter. And of course, back then, no one wanted to use their names. And so what do? I fix hearts, right? I was a heart surgeon. And so I just happened to pick that moniker and quite frankly, didn't do anything with it, right? I would just sort of be on social media like lots of people kind of consuming stuff. And then, again, maybe this is sort of where the destiny, the fate comes in, right? I start making all these changes. I start wanting to now talk about metabolic health and my different perspective on heart disease and what we should be doing to change it. And now iFix Hearts really is the brand behind, okay, let's really address the root cause of your heart disease. Let's really fix your heart instead of just putting a Band-Aid on it. And admittedly, this is something else I've come to recognize. And I tell people, right? Doesn't matter how good I might be as a heart surgeon. Doesn't matter how good all the heart surgeons and the cardiologists, are out there, right? You're never as good after you've had the heart surgery as you would have been if you didn't need the surgery in the first place. And so when I look at my role as a doctor, right, this isn't about me being a heart surgeon and only being able to do that. It's about what can I do to best improve the life of that patient that's in front of me. And if I can keep them from getting to the operating table, that is a major win. I've, recognized now that the vast majority of the heart surgeries that end up getting done in this country, that means that we have failed. And it doesn't mean that the patient has failed. It means that the medical system has failed that patient. There is no reason that heart disease should get to that end stage, that you now need this major operation for me to, yes, it's life-saving, it's life-improving. And listen, I feel blessed every day that I can offer that to the people that are in that situation. But I also am now able to talk to them and say, listen, the surgery isn't fixing your problem. It's putting a Band-Aid on. It's going to make you feel better. It's going to improve your life. But we need to address what got you here in the first place. Or, the unfortunate reality is the vast majority of people that have heart surgery, like I do, open heart surgery, or have stents placed, they still die of heart disease. They die years later. And yes, we've extended their life. And yes, we've temporarily improved their life, but they still die of heart disease because we haven't addressed the underlying problem that led them there in the first place.
Wow, huge. I mean, anyone listening who themselves are going through a cardiovascular issue or a loved one going through this, they're probably very well aware of what it's like to step into the cardiology, stream, if you will, like to know what that's like. Can you walk us through what a day in the life of the patient coming to you looks like? What type of patients you are drawn to you? What type of screening do you do? Because my imagination is you're not a fit for everybody and they're not a fit for you. And so I'd love to know your filter process. I would love to know your onboarding process and like what your expectations are, because it is a very different conversation having it with you than say the gentleman I spoke to this week about the patient with the 75 cholesterol. So I'm really curious, like, how does it look coming to somebody like you?
Yeah, so I have now built a nationwide telemedicine practice. So we see people all over the country. We see them by telemedicine, and got an amazing team that I've been thankful to put together. But the patients that we work with are patients who have started to kind of question the narrative. They might not know exactly where things are wrong, but they've just started to get this sense that, I go to my doctor, I'm worried about heart disease. They tell me it's cholesterol. They tell me to take this medication. Many of them feel lousy on the medication, have side effects. And their doctors are just like, well, that's all we got for you, right? And that's kind of another sad thing about all of this, because ultimately, one of the things I've recognized is we disempower patients, right? We take away their hope. We're just like, all you can do is take this medication, or, maybe you can eat a diet that is miserable, right? That no one can stick to. But, we tell you that, you got to eat this, this diet that in the end is making things worse and makes you feel worse. And so they're looking for another option, and we can give them that other perspective, right? And intuitively, it makes sense to the patients, right? When we sit down and we explain to them, about metabolic health and about, eating real food versus eating the processed food that they're driving you towards with the food pyramid, right? And, you can eat nutrient dense, bioavailable food that really does nourish your body. It provides your body with what it's actually looking for, which is the nutrients. And in the meantime, it takes care of this underlying smoldering problem that your doctor didn't know about, didn't recognize, didn't test for. And so we can do the blood work, we can do the testing. We do, obviously, again, we have a focus on heart disease. So we do some of the simple yet kind of advanced tests around heart disease.
Okay.
And this is a big one, right? There's something called a coronary artery calcium scan, a CAC scan. It literally takes 5 minutes to do this scan. They don't need to put an IV in you. And in most places here in the US, you can get it done for under $150, usually $50 to $100. And this will tell you exactly what is going on in your heart. This isn't some blood test trying to indirectly predict your risk of heart disease. This is showing you, do you have disease in the arteries of your heart? And how much disease do you have? And again, that gets us to, all right, now, if we're going to do something to manage this heart disease, we got to stop this metric from getting worse. And it's a very, simple thing for patients to see. I can literally pull it up on the computer screen and I can show them, here's the disease in your heart, right? And it would be like, you understand this in the cancer world, right? Imagine if all we were doing was looking at blood tests instead of imaging the cancer, right? Let's see where the cancer is. Let's see what, it looks like. And now let's measure, is it getting better or is it getting worse when you do whatever it is that you recommend? So we work with people very differently. It is, I'm proud to say that it's a different approach to heart disease, but it's also a different approach to medicine. It puts the patient back at the center. This isn't me, the doctor, telling you what you have to do. This is me empowering you to understand what's, driving your disease and what you can do to make it better. My business people keep yelling at me, right? Because all I want to do is put myself out of business, right? I don't, as a heart surgeon, I'm telling people I want less people to operate on. And then I come to this preventative side of my practice and I'm like, listen, it'll be great in a year from now. You don't need me any longer because you know what to do. That's how we work. And, so far, like I said, it's been going very well and we're getting some amazing results for people.
Hi, everybody. I am Dr. Nasha Winters. And if you've been listening to me for a while, you know my North Star is this: stop chasing symptoms and start rebuilding health from the ground up. That's why we created Metabolic Regen, an education platform rooted in the Terrain 10, the framework that I've learned to apply to myself and to tens of thousands of patients over 2 decades of clinical practice and cancer care. This isn't about cramming more protocols into your brain. It's about learning to think differently, to see patterns, to read the body's terrain, and to meet patients, or even yourself, where you are. Whether you're a clinician just starting your integrated journey, or a seasoned practitioner ready to bring metabolic and mitochondrial medicine to your toolkit, Metabolic Regen is here to support you. Inside, you will find immersive courses, real case studies, mentorship, and a global network of like-minded colleagues, all of us pulling together to change the story of medicine. If you're ready to be part of that shift, join us at metabolicregen.com. Let's rebuild medicine from the mitochondria out. Well, what I think is so encouraging here is, first of all, again, this is another place where we have such resonance, and that we like to test and assess and not guess as well. And that's what you do. And what you just described with this simple, inexpensive CAC score is you're showing a continuum. You're showing where are people at in this moment in time. And it's like a slider that certain choices will take them in the wrong direction and certain choices will take them in the right direction. You're giving them, it's like their quick biofeedback, really, an inexpensive tool for that. The other metrics you look at, I'm assuming, a lot of folks that listen to our podcast, know that some of the big metabolic markers are like your hip to waist ratio, your insulin levels, your lipid panels, but we're looking at it through a different filter, as Dr. Phil alluded to here. Even your stamina, your muscle mass, your body composition in general, including what's visceral, like what's wrapped around your organs versus what you're seeing flopping over your belt buckle, So these are the types of metrics we can also measure. And as those improve, you see cardiovascular improve, you see dementia improve, you see nephrology improve, you see neurology improve, you see cancer improve. It's just incredible that when we all move these metrics together, we all see different outcomes in our patients. And so one of the things I would think, I've got kind of a 3-part question. So I'm imagining, let's say I'm a patient, I have done I have no starting point of knowing where things are, but I have a strong family history and I'm coming to you for the first time. So I'd love to know like those general metrics that you'd start with in a person like that. And then the patient who's midstream, they're in it, they've got some big occlusions, maybe they've got high CAC scores, they've already got some metrics that are clearly saying you're in trouble, maybe they're on a few medications, maybe they are starting to look down the barrel of being on a surgical table. And then you have those folks who've been on the surgical table now. Maybe they have a stent, or maybe they had a cardio, like a MI, a myocardial infarct event. And now they're like, I don't want to do that again. Now what? So kind of having these 3 scenarios, how might you look at or approach each of those differently?
Yeah. So, at the beginning, right, we want to get those basic measures of, are you metabolically healthy or not, right? And where do you stand from a heart disease standpoint? So let's get that CAC scan. Let's get some basic blood work, right? And this might look like truly the basic measures of metabolic health. What is your fasting blood glucose level? What is your triglyceride level? What is your HDL? What's your blood pressure? And what's your waist circumference? We can start there, right? And I have many people that do. And in fact, if you go to my website, ifixhearts.com, right on the front page, take the free quiz, and it's going to ask you those 5 questions. And it's going to tell you, are you metabolically healthy or not? And, listen, I love it when I get emails from patients, from people, right? They're not even patients in the practice. They haven't paid me a dime. And they say, I went to your website, I took the quiz, I learned that I was metabolically unhealthy, I started making changes, and here I am, a year or 2 years later, and all of these great things have happened. Like, great, you don't need me, perfect. Like I said, my business people may not be too happy, but I couldn't be more thrilled when that occurs. And it does thankfully occur fairly often. So let's start there. Now, let's take it to the next level. Let's check your fasting insulin level. Let's check your hemoglobin A1C. Let's check some inflammation markers. C-reactive protein and homocysteine are most relevant from a cardiac standpoint. And then, yes, I'm focused on the lipids, but it's not looking at your LDL cholesterol level. It's looking at your HDL. It's looking at your triglycerides. And it's getting the advanced lipid test that's going to tell me about the quality of your cholesterol, not about how much cholesterol you have. It's what is the quality of your cholesterol. And that then leads us to the next level conversation. And again, it's amazing how you just keep circling back to the same point, because you have a patient and they have lots of the truly damaging, what we call atherogenic, small, dense LDL particles. And they're like, okay, so what do I do about this, right? Do I take a statin? And I say, well, the problem is that statins leave you with more small, dense particles. They lower the other particles. They don't lower the small, dense particles. So that isn't going to work. Why are these particles small and dense? They're small and dense because you have insulin resistance and because you have inflammation. So again, let's fix that problem. And, then when we have the patient that their CAC score is high, or maybe they're even having some symptoms, right? That's when we move to, okay, we got to do some more advanced imaging of the heart. maybe we're going to get something called a CT angiogram, which is going to give us very detailed pictures of what's going on in the heart. And that can lead to the conversation of, yeah, some people come to me and it's already time for a stent or for bypass surgery. And that's okay, right? We should use these tools that we have available to us smartly, but we're not just going to say, have your stent and move on with your life, right? We're going to say, get your stent, have your surgery, and now let's address those same underlying risk factors, the insulin resistance, the inflammation, that's going to get you back to the operating table, even if you've already been on it. And so it works it works across the continuum of the disease process. I always tell people, it's never too early to start thinking about this, but it's also never too late. We have a number of patients in their late 80s, 87, 88 years old in the practice, who are they're our favorite patients, right? They are absolutely doing amazing. They tell us they feel like they're in their 50s again, and they're out there, running laps and doing all these amazing things. So, like I said, you can start this at any point in the process, and the answer becomes the same. Let's stop it from getting worse first, and then let's see if we can make it better.
Wow, I love that. And again, this beautiful continuum. It's not if you do nothing, it's a very clear trajectory, right? I think that's sort of an inevitable trajectory. But what you're suggesting is that we can intervene at any step of the way and turn this ship around in the harbor. And it's just got such a more hopeful message than what I imagine you were sharing with patients prior to learning this for yourself 9 years ago. So I just think that's really extraordinary. You are such a voice, such an important voice in this, because it's one thing if like a naturopathic doctor is saying, or a dietitian is saying, change your diet. But when you have a cardiovascular surgeon, a cardiothoracic surgeon in there looking at this day in and day out and realizing it doesn't change until we change the environment in which that heart disease is taking place, you are a real spokesperson for this. And I'm so honored to have these conversations with you. The way I love to take this home is, first of all, I want folks to know exactly how to find you. It's going to be in the show notes. I already introduced it a little bit and you've alluded to it, but let people hear it again. Where do they learn from you? How do they follow you? How do they come and see you or work with you?
Yeah, so I Fix Hearts everywhere, all the social medias, YouTube, Twitter, X, whatever we call it these days, Instagram, all the places are I Fix Hearts. And then you can go to ifixhearts.com. Like I said, you can take the quiz right on the front page. You can hit the talk button and set up a call with my team to see if, our practice might be a good option for you. We see patients all 50 states and internationally, all via telemedicine. And we work with them, get them the testing that they need and get them the hope that they need, that they can improve their metabolic health, prevent heart disease, probably preventing some cancer along the way as well. And all of these other great things that come from focusing on the root cause of the problems that are plaguing our society these days.
I love it. And, your first book is so excellent, but you did let me know before we started the recording that you have another one in the hopper. Can you tell us a little teaser about that and when we might be looking for it to be available?
Yeah. So the first book, Stay Off My Operating Table, again, very blessed. It's been a bestseller, doing great. The sequel, I guess you can think of it as, is going to be called Stay Off My Kitchen Table. And what we're going to be doing sort of a deeper dive on is nutrient density, bioavailability. It's sort of the why between the, what. The first book kind of said, this is what we should do about the problem. And the second book is really going to be deep diving on, this is why, this is what we end up doing. And so that's going to be coming out July of 2026. So, and maybe by the time this has been released, it will be up available for pre-order in all the usual places, but if not, just kind of keep an eye out for it. And again, if you go to ifixhearts.com, you can sign up for my newsletter and keep updated on everything that we're up to.
I'm excited. This sounds like you're about to turn the ADA on its head.
Certainly going to be some of those institutions that are not going to be happy about this. And listen, again, one of the places we came together, right, was around the whole MAHA movement and what do we need to do that change the health of the nation. And this is certainly something I'm excited to see. And these are the conversations that we need to start having. I look at for me, right, the AHA, the American Heart Association, is my biggest focus. And again, I just look at this organization and say, you've been on this mission for 100 years and you have failed miserably. Why should we continue to listen to this organization when it has failed at its mission now for 100 years?
Wow. Yes. Doing the good work, Dr. Phil. I'm so appreciative. So I love to finish these conversations out with what I call my lightning round questions, just so people get a little deeper dive about who you are, the brilliance behind, your books, your work, just who you are and what makes you tick. So are you up for a couple of those?
Let's do it.
All right. Tell us, what is the morning routine that you never skip?
The morning routine that I never skip is going to be getting some sunlight in my eyes as early as possible after I wake up. And then for me, my morning routine is pretty easy because I usually don't eat. And it's usually a cup of black coffee, maybe with some salt and maybe with some creatine, depending on the day in it. So pretty easy morning routine from me.
I love it. Just get your engine revving from the get-go in the right direction. All right. What's your favorite protein source?
That's going to be steak every day.
Yeah, I love it. What do you believe is the most overrated health food?
Wow, that's a tough one. Anything that's not steak, right? Yeah, the most overrated, I would probably, put anything that says low fat on it is going to be the most overrated. So that applies to all the low fat, dairy that's out there, and certainly all the low fat, processed garbage that we have been told is healthy for us. One of the things I tell patients these days, that if it has the American Heart Association, stamp of approval on it, it is not heart healthy.
Oh my God, that's so good. That's a great sound piece of advice. Basically, run the other direction if you say the AHA stamp. That's very good advice. I can't wait for your book to take that further. All right, one supplement that you would actually recommend.
So the big one for me that maybe is less well known is going to be nattokinase. Nattokinase is has good evidence behind it that it can help reduce atherosclerotic plaque. It's a bit of a blood thinner, which again, blood clotting, we didn't really get a chance to touch on it, might be for conversation number 2. Yes. But blood clotting is very important in the plaque formation process. And so nattokinase is one that I end up recommending most often to my patients.
And it comes from a fermented soy. It's actually eaten pretty regularly in traditional Japanese cuisine, but it's almost unknown in this country, and it's pretty strong flavored. So it's nice that we've been able to encapsulate it.
Exactly.
Really cool there. Okay. A myth about heart health that you wish would vanish forever.
Well, the big one that we talked about, right? That cholesterol is the primary driver of heart disease.
I heard that. If you weren't a surgeon, what career would you choose?
Yeah, that's a great question. It turned out, again, and I don't know exactly why, but I always knew I wanted to be a surgeon. My parents swear from about 5 years old, if anyone asked me what I wanted to become, I didn't even say I wanted to be a doctor. I said I wanted to be a surgeon. And understand, I have no doctors in my family. I have no surgeons, so who knows why and how. But I'm not sure what else I would have done with my life. I guess I'm sort of discovering in this, sort of as I've launched this practice and everything and built a business, right? Being an entrepreneur of some sort, I guess, was maybe always in my destiny as well. And I enjoy that part of it. But I still love being a surgeon. I never regret my decision to go into it. And I still continue to do it, obviously, not because I need to really anymore, just because I want to.
Wow. What a gift it is to all of us that you had that calling so early on and now are even improving upon that career. Like you're changing this for future surgeons, which I think is also extraordinary, your passion in all of this. So what is the biggest lesson being both a patient and a surgeon taught you? What do you feel like you've learned the most about bringing those two worlds together?
Well, I think the most important lesson that I learned with this is just to ask more questions, to be more curious, right?
Oh, yeah.
Unfortunately, what I recognize now is the medical education process is actually very focused on not getting us to ask questions, right? It's all about follow the guideline, and this is the evidence, and don't question it. Just do what we sort of tell you to do and what we've trained you to do. And that has led us astray. And it was only when I started asking more questions that I was able to become a better physician, better surgeon, and I think better person all around.
Wow. I got chills for that one. That's beautiful. And last question, your last meal you'd want if you could have only one more.
Yeah, I'm going back to that steak, and it's probably going to be a nice big Wagyu tomahawk, ribeye. Let's do it all up, and I'll die a happy man, I guess.
Oh man, Dr. Phil, it is so great to be with you. I'm so excited for everyone to dive into this conversation. Thank you for knowing what you wanted to be when you grew up in this world and for even improving upon it today. So very blessed to know you and to share this information. And I look forward to another conversation when that next book comes out. So thanks for all your time and expertise today.
Thank you, Nasha.
Yay. Wow. This brings us to the end of yet another powerful conversation with Dr. Philip Ovadia today. His story reminds us that heart health isn't just about stents or surgeries. It's about fixing the root causes before they have ever landed you on an operating table. If you'd like to learn more about Dr. Ovadia's work, visit ifixhearts.com or pick up a copy of his book, Stay Off My Operating Table. You'll find links as well in our show notes. Thank you, as always, for listening to Metabolic Matters. And if this episode inspired you, please subscribe, leave a review, and share it with someone you love. Remember, the best medicine is prevention, and your choices today shape your health tomorrow. Until next time, stay curious, stay resilient, and stay metabolically healthy. Thanks so much for watching this episode of Metabolic Matters. If something in today's conversation resonated with you, give this video a thumbs up, subscribe to the channel, and tap the notification bell so you never miss a new exciting episode. Drop your thoughts or questions in the comments, as we'd love to hear from you. And don't forget to check the description below for show notes, guest links, and additional resources to support you and your journey. You can always follow us on Instagram and across social media at Metabolic Matters for updates, insights, and behind-the-scenes content. And a heartfelt thank you to Julie Newmark and Whiskey Flower for the beautiful music that brings this show to life. Until next time, stay empowered, stay curious, and keep metabolizing what matters.